Hello everyone, I am Glory P. Payo Romero from BS in English 1A. This day, I will going to discuss the Module 8 entitled Mood Disorder. Objectives. First, describe the symptoms, result, and risk factor of major depressive disorder. Number 2, understand the differences between major depressive disorder and persistent depressive disorder. And identify two subtypes of depression. Number 3, describe the symptoms and the risk factors of bipolar disorder. Number 4, describe genetic, biological, and psychological explanation of major depressive disorder. Number 5, discuss the relationship between mood disorder and societal ideation, as well as factors associated with suicide. What is mood disorder? Mood disorder, also known as affective disorders. It is a group of conditions where a disturbance in the person mood is the main underlying feature. Depressive disorders. Major depressive disorder or MDD, commonly called major depression, unipolar depression, or clinical depression, wherein a person has one or more major depressive episodes. People with major depressive experience symptoms most of the day, every day. Like many mental health conditions, it has little to do with what happened around you. You can have a loving family, tons of friends, and dream job. You can have the kind of life that others envy and still have depression. Some people might have a single episodes of major depression while others experience it throughout their life. Regardless of how long its symptoms last, major depression can cause problem in the relationship and daily activities. Atypical depression. Atypical depression refers to the depression that temporarily goes away in response to positive event. Having a typical depression can be particularly challenging because you may not always seem depressed to other or yourself, but it can also happen during an episode of major depression. It can occur with persistent depression as well. Other symptoms of atypical depression can include disordered eating, poor body image, insomnia, feeling of rejection and sensitivity to criticism, assorted aches and pain. Melancholic depression. Melancholic depression is a form of major depressive disorder or MDD, which present with melancholic features. MDD is a significant mental health condition characterized by persistent and intense feeling of sadness and hopelessness. Occasionally, they may also feel as if life isn't worth living. The disorder can affect many areas of life including work, school, and relationship. It may also impact mood and behavior as well as the various physical function such as appetite and sleep. People with MDD often lose interest in activities they once enjoy and have trouble getting through the day. Occasionally, they may also feel as if life isn't worth living. Psychotic depression. Psychotic depression is a subtype of major depression that occurs when a severe depression illness includes some form of psychosis. The psychosis could be hallucination, such as hearing a voice telling you that you are no good or worthless. Delusion, such as intense feeling of worthlessness, failure, or having committed a sin, or some other break with reality. Psychotic depression affects truly once out of every 4 people admitted to the hospital for depression. Catatonic depression. Catatonic depression is a rare and severe form of major depression involving disturbance of motor behavior and other symptoms. Here the person is mute and almost torporous, and either is immobile or exhibit purposely or even bizarre movement. Catatonic symptoms can also occur in schizophrenia or a manic episode, or can be due to neuroleptic malignant syndrome. Postpartum depression. Postpartum depression occurs in women soon after giving birth. Symptoms include sadness and hopelessness. Counseling and antidepressant are treatment option. Premenstrual dysphoric disorder or PMDD is a severe and disabling form of premenstrual syndrome affecting 3 to 8% of menstruating women. The disorder consists of a closure of affective, behavioral, and somatic syndrome that recur monthly during the luteal phase of menstrual cycle. Seasonal depression. Seasonal depression, also called seasonal affective disorder, and clinically known as major depressive disorder with seasonal pattern, is depression that related to certain season. For most people, it tends to happen during the winter months. Symptoms often begin in the fall as days start to get shorter and continue through the winter. Dysthymia is a condition related to unipolar depression, where the same physical and cognitive problems are evident, but they are not as severe and tend to last longer, usually at least 2 years. The treatment of dysthymia is largely the same as for major depression, including antidepressant medication and psychotherapy. Double depression. Double depression can be defined as fairly depressed mood dysthymia that lasts for at least 2 years, as it punctuated by period of major depression. Depressive personality disorder or DPD is a controversial psychiatric diagnosis that denotes a personality disorder with depressive feature. Originally included in the DSM-2, depressive personality disorder was removed from the DSM-3 and DSM-3R. Recently, it has been reconsidered for restatement as a diagnosis. Depressive personality disorder is currently described in Appendix B in the DSM-4-TR as worth for further study. Recurrent brief depression or RBD, distinguished from major depressive disorder primarily by differences in duration. People with RBD have depressive episodes about once per month, with individual episode lasting less than 2 weeks and typically less than 2 to 3 days. Minor depressive disorder or simply minor depression, which refers to a depression that does not meet full criteria for major depression, but in which at least two symptoms are present for 2 weeks. Bipolar disorder. Bipolar disorder, also known as manic depression, is a mental illness that brings severe high and low moods and change in sleep, energy, thinking, and behavior. People who have bipolar disorder can have periods in which they feel overly happy and energized, and other periods of feeling very sad, hopeless, and sluggish. In between this period, they usually feel normal. You can think of the highs of the lows as two poles of mood, which is why it's called bipolar disorder. Bipolar types. There are few types of bipolar disorder, including bipolar 1 disorder, which this type you have extreme erratic behavior with manic up periods that last at least a week or are so severe that you need medical care. They are also usually extreme down period that lasts at least 2 weeks. Bipolar 2 disorder. With this type, you also have erratic highs and lows, but it isn't an extremely extreme as bipolar 1. Cyclotamic disorder. This type involves period of manic and depressive behavior that lasts at least 2 years in adult or 1 year in children and teens. The symptoms the symptoms aren't as intense as bipolar 1 or bipolar disorder 2. With any type of bipolar disorder, misuse of drugs and alcohol use can lead to more episodes. Having bipolar disorder and alcohol use disorder, known as dual diagnosis, requires help for the specialist who can address both issues. Substance induced. A mood disorder can be classified as substance induced if its etiology can be traced to the direct psychologic effect of psychoactive drugs or other chemical substance, or if the development of the mood disorder occurs contemporaneously with substance intoxication or withdrawal. Also, an individual may have a mood disorder with a substance abuse disorder. Alcohol-induced. High rates of major depressive disorder occurs in heavy drinkers and those with alcoholism. Controversially, controversy have previously surrounded whether those who abuse alcohol and develop depression were self-medicating their pre-existing depression. Depression and other mental health problems. Depression and other mental health problems associated with alcohol misuse may be due to distortion of brain chemistry, as they tend to improve to their own after a period of abstinence. Benzodiazepine induced. Benzodiazepines such as alprazolam, clonazepam, lorazepam, and diazepam can cause both depression and mania. Benzodiazepines are a class of medication commonly used to treat anxiety, panic attack, and insomnia, and are also commonly misused and abused. Those with anxiety, panic, and sleep problems commonly have negative emotion and thoughts, depression, suicidal ideation, and often have comorbid depressive disorder. The long-term use of benzodiazepine may have a similar effect on the brain as alcohol and are also implicated in depression. As with alcohol, the effect of benzodiazepine on neurochemistry, such as decreased levels of serotonin and norepinephrine, are believed to be the responsible for the increased depression. Due to another medical condition, mood disorder due to a general medical condition is used to describe manic or depressive episode which occurs secondary to a medical condition.